when the sperm has already passed, because it takes 6 hours for that sperm to swim to the tubes, and anything can happen. So the second question was about blocked tubes. Signs. There are no signs of blocked tubes. Most women who have blocked tubes have no sign at all. If you're lucky, we have suspicions. One of the suspicions is if you have been trying to get pregnant for a period of 6 months to a year, you cannot, and you're a young woman, then we suspect that 90% of the time it is blocked tubes. If we ask you and your periods are cramping so much, then we think you have endometriosis. If you've ever aborted, especially using instruments, then we know that if your life is a promiscuous life and you have many boyfriends or unsafe, then we know you had an STD. So that is how. But blocked tubes does not cause, because the women will tell you have blocked tubes and they say, but I menstruate. How comes I have blocked tubes when I menstruate? I think I explained that. I don't expect you to ask that question, because you know that menstruation has nothing to do with the tubes. Lastly, herbs. I do not have any evidence that herbs work, but what I know is that most of our drugs are derived from herbs. So if someone has it right and herbs help them to stop cramps, then that's a good thing. But what I should say is that I do not like people to continue treating, self-medicating what they don't know. I said if anyone has painful periods to an extent that it requires you to get a herb, it means that you need to see a doctor to rule out endometriosis. For me, that is the message. Thank you. Okay, I didn't get your name again. Atricia, not Patricia. Okay, or they cut off the P and. Okay, that's a good question also. It's about vaginal hygiene. It's not just a question about the pH, but it is maybe something that I omitted when I was talking about the normal, and we want to bring a bit more light to this. The vagina is a wonderful organ, wonderful in a way that it regulates itself. It regulates itself, and it's because of that it has been able to survive as a reproductive organ for all those reproductive years. Otherwise it would be extinct. Extinct, why? Because these men are on a mission to destroy it, and be able to do money work. Those are the same cells that are designed on the vaginal wall, that they grow, they reach a point when they are outgrown and they shed. So it keeps shedding, but you might never know that it sheds. That is one of the way it self-regulates and the way it protects itself from trauma. Trauma, especially of the things you do to it. Some of them unbelievable. Yes. I've seen a woman who came and she had packed the entire doll into her vagina. Women pack cartons of drugs to smuggle them across borders. A woman packed 5 kilograms of marijuana in her vagina. You cannot do that to the rectum because it is specially designed to handle stress of the baby, not of marijuana, and the stress of course, of intercourse. Of course, the other thing, it is stretchable. It can stretch to many limits. Because that is how God designed it, to accommodate the size of any baby. Now, it also designed to handle bacteria that are, in the environment. Remember I said that the design is not a good one because everything that enters in the vagina has a way of getting into the abdomen. So God was clever, he gave it these protective mechanisms. Otherwise, every month you would be sick. One of them is there are special bacteria that grow there. By puberty, when you start menarche, 12 years, 9 years, these bacteria start to colonize the vaginal wall. Among those, we have what we call lactobacillus. It's a very special bacteria, and it keeps producing acid. It keeps producing acid, and that acid is supposed to maintain and keep away all the germs. So yes, it is true, as she said, that the woman's vagina is acidic. And the pH is around 6 to 7. Not so tough like the pH of the stomach. That is why men can go on eating it and they survive. But the acid inside the stomach can burn your skin to ashes. So it is relatively friendly, but it is not friendly to bacteria. It is meant to kill bacteria. There are other organisms that colonize the vagina, and these are called yeasts. Women have some yeasts in the vagina, but now the problem is that these yeasts tend to overgrow. It is the acid to fight the yeasts, because yeasts cannot grow in an acidic environment. So when the yeasts get an opportunity to grow, like Candida, you've heard of Candida, the one which causes itche. When you're pregnant and the pH is different because of the hormones, when you take a lot of antibiotics that kill this bacteria, that's why we don't want, we say, as a woman, please don't self-medicate. Do not go to the pharmacy and tell them, mpayo kwa amoxicillin, mpayo, Even with a cough, women should not just take antibiotics. Antibiotic is the biggest problem to a woman's vagina because it kills these bacteria, the one that protect. And once they die or reduce, then the acidity reduces, and now Candida will say, oh, thank you very much, and you start to grow. You start getting a thrush, the discharge that looks like porridge, yogurt, itching, and I've seen women suffering with Candida year after year. They cannot use any drug, it doesn't work on them because they've destroyed the colony. How do they destroy the colony? One, I've already said, use of antibiotics. Don't go to get antibiotics only when you need it. Most of the coughs you treat with antibiotics are just viral things. They don't need antibiotics. These days antibiotics have become fashionable. You're seeing people moving around in taxis with cannulas. people are making money, but women are suffering eventually with a lot of these vaginal discharges that don't go away because they have killed the bacteria that are supposed to maintain the pH. The other bad habit, of course, is douching. When you start using detergents, all soaps that have detergents are not good for that bacteria. So when they kill the bacteria, you're going to get into problems. You should not douche. What you should do is to wash with the normal water. Because I said the vagina is self-cleansing. Why do you disturb it? Once in a while, they advise you to clean deeper to remove the cervical mucus, but that is like once a week without soap. The moment you start brushing it, you're causing problems. If you are sexually active and married, then God gave a man the brush to clean the what? That is the natural brush. And semen is friendly to the vaginal wall. It has contents that clean the vagina. Anyway, so couples who are married, it's healthy. They clean the vagina naturally. But you, young people, don't douche. Don't go and buy jig. Don't put Coca-Cola. And what? Shana. What is Shana?
It's a gentle wash.
So don't put anything detergent. So these companies have come up with friendly vaginal hygiene products, like the one she talked about. There are many on market. There is V-Wash, La Wash, Wash, What Wash. Basically what they contain is the concoction of that bacteria, the one we talked about, lactobacillus, to maintain your pH. You can use that, it is okay. It improves the scent, the smell, but don't use it if you have an infection. First go to the doctor to find out that the infection you have can be treated first. It is more of a hygienic thing that you can keep in your bathroom, in your shower, and use regularly to maintain the bacteria that are supposed to keep the vagina acidic. Hope I answered your question. So largely I just wanted to bring out several other things, especially vaginal hygiene, which is a key thing with young women. I don't know you're going of that environment, isn't it? So that is why in his design it was clear that you should not menstruate more than 5 days. Because if you keep blood in that cavity for long, then you are going to disorganize the environment. So if you see a woman who bleeds a lot, week after week, periods, they don't stop, then it's also what? A problem. They have to seek health care. So menstrual hygiene is also an important thing that we have to address right from schools. Unluckily that we are still a poor country, and these girls do not have the luxury to buy pads. In the villages we find them using towels, others use grass, others use this paper, but most time they'll pack for them a piece of cloth which you will use for the whole day. The normal pad is supposed to accommodate 35 mils of blood, and it will get soaked. You have to change it. 35 mils, most of them. And if you keep it longer than 8 hours, the bacteria love blood. They feed on blood because blood is nutritious. They will start feeding on the blood and grow and cause an infection. So changing pads is one of the critical things we teach the young girls. So they cannot change because they are not in position to afford the pads, and then that is a problem. If they bleed so much, heavy bleeding, it has to be addressed, because if it's not addressed, I don't think anyone can afford having a pad for a day, a whole packet for a day, because some girls use the whole packet for a day. So, and they keep quiet, and that is not normal. So you need to know these things so that you keep talking about them and help these people to bring them to us, and we help them. Thank you. In women, including exams, including poverty, abject poverty. If you are in poverty and you cannot earn money, it's stress. Including that one as well, emotional stress, including the stress of trying to win top model. Then your body will adjust by producing hormones which will stop the menstrual cycle. Okay? But this is temporary. You should not worry about it. It is a physiological way. And as soon as you get better, your periods will return. So it is not a disease. I just mentioned it because I do not want you to start running to hospital all the time because you've missed a period. You just have to look into your routines and see whether anything has changed. But if they don't come for more than 2 months and you're not an athlete or you've not lost too much, well, then you have to seek for help. Pills, not necessarily just pills. I think I should talk for family planning in general. Family planning does not cause cancer. Family planning does not cause fibroids, ebizimba mu nabaana. Family planning does not cause STDs. What else do they say? What is the other myth about family planning that you know? Family planning does not cause infertility. However, family planning, you know, when you go for family planning, it means that you're trying to avoid a pregnancy, isn't it? So for us, we call it subfertility. Subfertility means you are delaying. Of course, there are some family planning methods which stay for long, like the injections and the implants you put in your arm. The drug is designed to stay long in the body, and the longer you use it, the more you delay, but eventually you can conceive. It's just a delay, a subfertility. So they don't cause infertility. They don't cause cancer. In any way, most of them prevent cancer. Most of them have hormones that prevent cancer. Most of the cancers of women are due to the hormone estrogen, excess estrogen. Cancer of the breast, cancer of the uterus, commonly caused by excess hormone of estrogen. And when you use this family planning method that have the other hormone, progesterone, they will be protective. And sometimes we even use them to treat. The pill is a good one. Actually, it is one of the best because it's a balanced pill. It has estrogen and progesterone, and they made it to mimic your cycle, the same hormones you have in your body as women. And once taken properly, it will protect a pregnancy for as long as you wish. And the moment you stop, it will never delay you from getting a pregnancy. So it is the best. The problem with the pill, you have to take it every day at the same time of the day, whether the man is around or not. Even if he goes for safari abroad for 2 weeks or a month, you continue taking, because the drug comes out of the body very quickly. But it is the only dangerous pill is the Chinese pill. I see women not like shortcuts. So there is this pill that came on market where you take just once a month, because they think it is easier to take compared to the other one you take every day. Everyone has jumped onto that wagon. So now we see a lot of women taking monthly pills, and monthly pills have a very tough hormone which disturbs their cycle. So we do not advise that you take a monthly pill. Go to your doctor always if you need family planning. Family planning means a plan, isn't it? It means you have a plan. And this plan is supposed to be a birth control plan. So you present your plan to a doctor. I want to delay my fertility for a month. I want to delay my fertility for 2 years. I want to delay my fertility for 10 years. I've stopped having children. I don't want anything to do with that. So it is a plan you come up with. We do not give you the plan. You come and tell us about your plan. If you are still in school, or you never delivered any child, it's a temporary plan. If you have had some children and you want to delay your next child for the next 5 years, we ask you, how long do you want to delay? Maybe you want to finish with your course, you want to get done with your role modeling career. Then we ask you, what is your plan? So we design family planning to it has to be tailored to your plan. Okay? So don't go to the pharmacy and tell them, Mpayoka family planning. Do not go to your friend and ask them what works for you. Because what works for her will not work for you. What is her plan is not your plan. So always never take any family planning method without coming to the gyne. Present your plan. They will advise you about what you should use and why. Sometimes depending on other circumstances, the weight, whether you're taking any drugs for any other thing, if you have any other illness, there are many things we look at. But don't just take this family planning method. That's why people have dismissed, have a lot of myth around them. But all these myths they're talking about are not correct.
There is... I'm not asking my question. It's in group and someone wants to know. Actually, she's there on Zoom. So she's asking, is there a facility where girls can have smears that detect for cancer at affordable prices, or even free facilities in Uganda? And are ladies empowered with education for these smears? Yeah.
Hospital, they put a small speculum. We don't do it on virgins because we assume as a virgin you have never seen a man who will transmit HPV virus that will cause a cancer. So it is done only on women who have had intercourse before. Or they need to put a small gadget called a speculum to look for your cervix. And then they get some small special kit and they smear. Smear means they brush and take the cells of your cervix and they give them to the pathologist to look in a microscope and look for cells that have changes of cervical cancer. Why do we do this? Simply because, one, cervical cancer is a sexually transmitted disease. We now all agree. When we see with cervical cancer, automatically we know that there was a contact with a male who had this virus. This virus is transmitted by males, very common. The burden of it is a lot in urban areas like in Kampala. Almost every fifth man has HPV. Now, when a woman gets in contact with this virus, it will stay on the cervical cells and grow for a long period of time, up to almost 10 years. It's when it will start causing these changes that can be seen on pap smear. The pap smear is very important for every woman who is sexually active. Reason is to detect the virus or the changes when it is still early. It is almost the only cancer that we can cure 100%, only if caught early. Because if we still find it on the cervix, then there are measures we can use to treat it before it spreads. But once it has spread, it is disaster. It is one of the common causes of death among all cancers, second to breast. Okay? So, centers, yes, almost every hospital does this. Government and private. So you can walk in any of these hospitals and tell them you need a pap smear. Some of them, I'm not very certain whether government hospitals offer the service for free, but I'm sure that most hospitals do cervical cancer screening with even other methods. There are other methods apart from pap for free. There is a whole reproductive unit in Mulago that's supposed to deal with this. You can always walk there. There is a whole reproductive unit at Kisubi Hospital, where I also work sometimes. Deals with adolescent health, all issues, not just cancer screening, but STDs, HIV counseling, all this knowledge you're talking about. They have very experienced counselors who will take you through everything you need to know as an adolescent. And if you need to get it private, it is still cheap. It's around average of 50,000 shillings. It is cheap because I don't think any one of you can fail to get 50,000 shillings in 3 years.
Oh God.
The test is done every 3 years. So there's no reason why you cannot do it. So if you think you've ever had sexual encounters, it is a test you should have on your menu every 3 years. But if you think that you're a virgin or you've not indulged in any way, or you have a sister or a friend who is between 9 years and 15 years, send them for HPV vaccine. They get 2 doses and they are given in most of these hospitals for free. Okay? For free. These days, they have started even giving HPV to women who have had intercourse. Don't worry, you can go and lie to them. I've never touched a man. They'll give you a vaccine. On assumption, we usually give it on assumption that there are women who have had intercourse, but they are still free of the virus, isn't it? So there is now a bit of change of attitude. Anyone can be given a vaccine. It does nothing to your health. Very safe. And if you don't have the virus, good enough. You're protected. If you already have it, keep screening. So that is the message about HPV. So it is, unfortunately for the men, it is difficult. We cannot know who has the virus or not. We wish there was a test that quickly screens the men and we know who is a carrier. But it would be nice for the males to get circumcised. Because when you get circumcised, it reduces the chances of spreading.
Then the second question is, are the pills that they made for men in first experience really effective? And the third one. Second one is, okay, I had that they made the first experience for men. And no, like they're taking the first step.
Any hands?
Yeah.
Any hands?
No, like they help you not to make a girlfriend.
Permanent and condoms or abstinence. Okay? For males, unfortunately, technology has not given you any drugs to stop you from making women pregnant, unfortunately, because a woman's cycle is very predictable, easy to adjust. A male cycle is hard. You just have to shut it down because it produces many sperms at any given time of the cycle. So there's nothing like that I know of. The other question was, what do the girls think? What do the girls think? It is not hygienically good in any way for a woman to have intercourse during their menses. That is what I should say, because first of all, you have a bigger dry spell. Why do you wait for menses? Is it that you're impatient, you can't wait? At this time, the woman is shedding, and because they are shedding, the endometrium is open, and because it is open, it is easy to spread infections to those open blood vessels. So the risk of infection is so high. And two, we said endometriosis is a real thing of backflow, so your sexual intercourse can increase the risk of that. So I don't think it is a good thing. I think we need like 2 quick last questions, 2 quick urgent for anyone who has not asked before we close. I'm told people need to go different ways, so if we need to wind up. Who has not asked? 2 quick burning questions. Maybe she hasn't asked, and 1 male here. Yes. Things that increase iron. Okay? But most times if you don't shed that much or not prolonged, then you shouldn't really worry. Maybe what I should emphasize is you take a lot of water, because sometimes this blood loss, however little it looks, it can give you issues like dizziness and all that. So, but not any particular special food. Did you have anything in mind? Or maybe you're asking it in the spirit of people who have cramps, significant cramps. If you have cramps that are not so significant, they don't stop you from going about with your usual activities. Just get some Panadol. Keep it in your purse somewhere. Just take a few tablets of Panadol to always reduce the cramps. It is a normal thing. However, if you have significant cramps, and you have to find yourself to go to bed, to miss a class, to miss church, then that is considered significant. Go and see a doctor. Don't take herbs. Don't take particular foods. That is considered significant and should not be ignored. And it is part of the reason I wanted you to become ambassadors for menstrual pain. Because endometriosis is real, it starts like that, and it's a very big burden now everywhere in the world. Okay? So anyone who has those severe cramps, they must visit a gyne to make sure that it's not endometriosis before it is too late. For the gentleman, you asked about anorgasmia. You asked on behalf of the women, or
Feminists.
yes, it is a very big and controversial topic. Anorgasmia. You can go to the internet and type in that word. It's going to bring you a lot of information. But what I should say, as I said, statistically it is true that 50% of women do not get orgasm. They do not reach climax. And the biggest cause or reason is the men, because men do not know what to do. And I think it is one of the reasons I started by teaching the normal. I also complained that attention is given to the ladies but never to the men. I also mentioned that the female genital organ is designed in two ways. It has the sexual erotic organ called the vulva on top, with the clitoris having 800 nerves, all waiting for sensation and stimulation, isn't it? Unfortunately, men go for the birth canal. There is something called the G-spot. Has anyone heard about it? It is assumed to be a small area anterior up on the vagina after where the urinary tube is, called the urethra. And it is believed that some women, once stimulated around that area, they can get an orgasm. But that is in a very small percentage. Most of sexual stimulation in a woman is at the what? At the clitoris. That is known. Unfortunately, men do not spend enough time to do that. But it is also known that getting an orgasm in a woman is a practice that has to be learned. It is not automatic like a male. Males is a very simple and automatic thing. Women have to learn how to get. It is a practice. Just like the way you learn to play football and get tricks, it is the same way women have to learn to get an orgasm. I've seen many women who are married and they come to you and tell you, I've been in marriage 10 years, I don't know what this means. And then others are frustrated that men are selfish. They think of themselves, and once they are done, they walk away and they leave them in agony. But it is a responsibility of both to talk about it. And a woman, never shy away from telling your partner what makes you good, isn't it? You should always discuss with them and tell them that this is what I want you to do. So basically that's what I should say, but there is a lot there that you can read so that you can empower yourself with this kind of information. Otherwise, thank you very much. It has been a pleasure to meet you as top models, and I hope you will spread this gospel to your peers. Thank you.
So we are trying to see how to bring in apart from that, we don't see much distress. So endometriosis. Because I was suffering. And then another thing I wanted to ask, Doctor, if someone else to give birth, and then like our career woman, I don't have time to miss. That's why I'm just giving back my like from. doctor, I just want, I don't know, I want my opportunity. They told me, I'm ready, I want it. Yeah, no, not that I tried and paid, but I want to do birth control and I'm done.
But that's it. As I said earlier, the lifespan, the reproductive lifespan of the woman is number, okay? Between 18 and 34. And I know these days, career women want to pursue everything, but also having career. So don't forget about your reproductive career. When the modeling is done, I don't know when the limit is. Sometimes you want to actually not balance. Don't think about it. Don't want to balance. Don't want to balance it after the fight. Because the cost of not having children is so big. The cost of treating infertility is so huge. So if you think you're going to have children so less, then you better save enough money to go through that hassle. So that is the message of the private line. As much as possible that you can have children appropriate at the right time. I'm not saying to have them married, but have it at the back of your mind that you plan.
Yeah, done. So we are going to organize ourselves and have pictures with doctor outside.
We are Top Model Uganda, the leading modeling competition.